In this video, I'm going to discuss how these hemodynamic parameters are going to be affected by the application of the nitrates, nifedipine, verapamil, as well as beta blockers. Now, with nitrates and nifedipine, what they will do is that they will cause both arterial as well as venous dilation. And so due to the arterial dilation, therefore there would be decreased total peripheral resistance, as a consequence of which blood pressure will now decrease. And so now, since there is also decreased total peripheral resistance, therefore the work of the heart will decrease, so the myocardial oxygen consumption will also decrease, and also it takes less time for the heart to pump blood out in the system, so ejection time also decreases. But then due to decreased blood pressure, there would be a reflex increase in the contractility as well as in the heart rate. And so the end diastolic volume will also be decreased, because due to the venous dilation, there is more blood that now is staying inside the veins, as a consequence of which less blood is returning to the heart, and thus there would be decreased end diastolic volume. And then with the verapamil and beta blockers, they would directly act on the heart to decrease contractility and the heart rate, as a consequence of which there would be decreased myocardial oxygen consumption and decreased blood pressure. Now, because of the decreased heart rate, there is more time for the heart to be filled with the blood, and thus end diastolic volume will be increased. And then at the same time, because of the decreased contractility and the decreased heart rate, it takes longer for the heart to pump the blood out of the chambers, and thus the ejection time will increase. And that concludes our discussion.